let's start this beautiful webinar. Today we are doing this Struggling with Feeding Challenges Part 2, and Dr. Sam is going to talk about primitive reflexes impacting your child's ability to eat. So please, everybody unmute yourself and listen carefully what doctor is going to say. Dr. Sam, you can start the webinar.
Yeah, hi, good morning, everyone. Just give me a second, please. Perfect. Yeah. Welcome to the part 2 of feeding challenges, and today we'll discuss the importance of what role does primitive reflexes play, especially when it uh, comes to feeding. And the difficulties what children face if the primitive reflexes, if they have not been integrated, or if the primitive reflexes are retained. So we'll take it forward. Prior going to the discussion, can we have, does anyone have any questions to be asked? Maybe I'll wait for another 2 or 3 more minutes. Meanwhile, you can ask me any questions. I'll keep it open for next 3 minutes. I'll keep the floor open for 3 minutes, and then we'll go ahead with the topic for the discussion.
Hi, Dr. Samraj. Very good morning. I have a question.
Yeah, hi, ma'am. Yeah, you can go ahead.
Yeah. So, Dr. Samraj, my daughter is 9 years old, and she is actually, when she's doing straw sucking, when I tell her that use your lips, then definitely she is having good suck and she is using her lips to drink water or anything. But by default, naturally, she tends to use the tip of her tongue. And when I tell her, definitely she is, trying, and she is able to do it with her lips, by making proper pout. But by default, naturally, she is more comfortable with using her tongue. So anything which you suggest here, like, I know it deals with the muscle tone, and she is having good muscle tone, she is having good mouth closure, no issues, good speech. But by default, when I see this, I think, is there something missing? Is it dealing with primitive reflexes?
Definitely. I probably I'm thinking about it from 2 or 3 different perspectives here. Number one, what about her tongue thrust? Does she have tongue thrusting?
Mm, no, not now. Of course, when she was a child, it was there, but not now.
It's not there now. Tongue thrusting is not
Mm.
there. And does she spill while drinking it from the tip of the tongue? Does she have any spilling?
No.
She doesn't spill.
Mm.
Then in those scenarios, why would I like to change the pattern which a child is already comfortable with?
Because, okay, are you asking why we should change the pattern, right?
Yeah.
Because, doctor, I mean, ideally, if you see, to drink from a straw, the ideal pattern is to use your lips, right? We should not use our tongue, because uh, it is not good for your tongue. It is not good for the muscle tone of the tongue and overall mouth health, right?
Uh-huh. Uh-huh. Okay. Mm,
I'm trying to understand here. Actually, I'm talking about Myra, doctor. You have also, Myra, I think 3 years back, I took my program, I mean, your program with her.
uh-huh.
So,
Okay. Um, what about, did anybody check for her suck, swallow, breathe reflex?
Not, I don't think so. I mean, sucking and swallowing was okay whenever I have dealt with speech therapist, but breathing, I don't feel any issue is there.
Okay. What we'll do is I'll probably address your question after we finish the session because
Sure.
I'm going to show you videos on how to check for this primitive reflexes. Okay.
Okay.
Then
Sure, doc.
probably you can have a look at those primitive reflexes, and then probably the discussion might become more meaningful.
Definitely. Thank you so much.
Yeah. Yeah. Shravani ma'am, should I start?
Yes, sir. And one more parent is asking about that they missed the part one. Can you please brief the part one in few minutes if possible?
Okay. So the part one we spoke about, one second. Sushma, my page is not moving. Can you ask to come once? Page is not moving, sir. Yeah. So these were the topics which we actually wanted to cover in the feeding, the series of webinars, whatever we are going to talk regarding feeding. So last time we had our discussion regarding the orofacial evaluations and what it means to have Dr. Vivek was there along with us. He is a periodontist. So he very thoroughly explained us what it means to uh, have the structures in place for the feeding to be for how do I put it? Oh yeah. Uh, what's the importance of the orofacial structures, the role of orofacial structures, like the lips, the temporomandibular joint, the tongue, and what kind of positions which need to be adapted, and the role of the facial expressions completely, and how to evaluate them, and what kind of difficulties from the structural perspective, what kind of difficulties a child might be having is what we have discussed last time. And that particularly what we have done over there was we have asked parents to share their email IDs so that we can forward the feeding evaluation sheets to them so that they can fill those sheets and come back to us basically. Then we thought we would discuss more about the structural deformities and the implication of having structural deformities and how it can inhibit or how it can make things difficult for the child. So that's something what we spoke in our last uh, session. And probably today's session we will be talking, as I mentioned, we would be talking more about the impact of primitive reflexes as such. Mm, yeah. So, when we are talking about primitive reflexes or the impact of the primitive reflexes, I would like you to understand that every child is born with these primitive reflexes, right? They are born basically from the womb. They start developing these reflexes for their survival and for thriving themselves once they get exposed with the environment, and how these reflexes, the primitive reflexes as such, because there are certain reflexes which we carry it out throughout our life, but there will be certain reflexes which are called primitive reflexes, which are supposed to be integrated at least say by 6 to 8 months, most of the reflexes they develop at zero, and they need to be integrated by 8 months, by maximum 8 months, and few reflexes go up to 12 months too. And what you need to understand is these reflex movements, they literally grow the brain. And this repetitive and automatic reflex movements, they're pretty much essential for the development of balance, posture, strength, their fine motor and gross motor abilities, their vision, their hearing, their speech and social emotional skills, and learning and communicating. So to understand these reflexes, what you need to let me talk to you about Claire Hawking. She is a brain gym instructor. I'll talk about her model. Basically, the model says it's a pyramidal model. In this model, what they talk about is uh, your CNS, your brain, your central nervous system needs to be first in place. And then the next step comes on top of it is integration of primitive reflexes and development of your senses, which means the sensory motor integration. The sensory motor integration happens only if your reflexes are integrated and your senses are parallelly growing along with that. So 0 to 2 years phase of life for any child on the cognitive theory model is all about sensory motor uh, development, right? So that's what precisely happens. And from there, a human being tends to develop all the postural reflexes, basically, which means development and integration of ability to be in an upright posture and balance yourself against gravity, which is one of the most important tasks while feeding, right? How the child is being seated, whether the posture is erect or posture is slouched, whether child is leaning more onto the table, child is not comfortable with different heights. So these postural reflexes are the ones which get established only if your primitive reflexes have been integrated, if they are not retained. So from there, you start developing motor patterns, you start developing perceiving the world through your senses, and then you develop conceptualization, and then comes your activities of daily living, becoming independent in activities of your daily living, which means their feeding, their toileting, their bathing, all those components of life skills, all those components of life skills starts happening there. So that's how much important is your primitive reflexes for you. So Shravani ma'am, you're able to view my video?
We can see you, sir.
Okay, you can see me. Perfect. So while talking about primitive reflexes, especially pertaining to feeding as such, these are certain reflexes which usually have impact on overall task of feeding as such. So it's very important to see whether these reflexes have been integrated, so that if they have not integrated, then there is no point in working on feeding skills for the child. So it's very, very important. It's very, very important to first look for test for these primitive reflexes, and if they are still not integrated, you need to be working upon integration of these reflexes, and then comes on how to work upon feeding, because these are certain the prerequisite skills. Rather, I probably need to say that these are the prerequisite skills which are pretty very much important prior working on to prior you go on working on feeding as such. Okay, so usually every child every child will have this primitive reflexes, and they grow out of it, and the movements will become more volitional, and the movements are more controlled, and they know how to use their body to do any kind of act. So to understand this, what happens if these primitive reflexes are not in place? So let me explain you the uh, uh, hand brain model for you. When you talk about hand brain model, what you need to understand is these primitive reflexes emerge from the brain stem in your brain, and which is at the oldest part of the brain, and on top of it is what you get all your lobes, where that frontal lobe or occipital lobe or temporal lobes, all the lobes will come on top of it. So what you need to understand here is hand in brain model is something where you keep your thumb inside your palm and fold your fingers like this, and fold your fingers like this. So this particular area is your cortex. This particular area is your cortex. This is your limbic system, and this is your brainstem. So basically the reflexive activity is happening here, and your limbic system is the one which takes care of your emotional regulation, your ability to think, your ability to, it establishes the memory, it helps in developing the language and all the other parts. And when you close your hand, this is called the cortex. And here, the knuckles, the last knuckles, is what we call it as prefrontal. Many of you would have heard about the term, right? The prefrontal area, where all the information, if eyes are here, the information is perceived from there, and this is your auditory, hearing is perceived from here. So all the information is perceived from the outside world, and it gets integrated with your limbic system, and thereby your ability to act as per the scenario is being maintained. And here is what your fight, flight, and freeze responses takes place. So your reflex activity as such, when you talk about reflexes, reflex as such is acting immediately upon things, right? So whenever you are threatened or you're perceiving some you're perceiving things around you are dangerous, this is where the brainstem starts taking shape. And once brainstem is triggered, your limbic system does not really coordinate with and integrate with your senses. So that's where the disconnect gets established in children. That's where their behaviors will go wrong. So it is pretty important for you to understand that the part which takes care of your fight, flight, freeze, or your ability to think rationally is all disturbed, and there is no integration happening with their surroundings. So that much how big the role of a reflex would be. And most often what usually happens is whenever these reflexes are not being addressed the way they need to be, usually children are labeled, right? Children are labeled as, they are daydreamers, or they are not concentrating, they are lazy, or they are defiant, they are not cooperative, or, they are always making some trouble. And if you really go back into the research, and look, especially in children with attention deficit and hyperactivity, with ADHD, the size of the brain is 10% smaller than others, because the reflex part, which is supposed to be taken care, which conveys the messages from your left brain to the right brain and allows the brain to grow. So if this is disturbed, which means there is a lot of chaos which is happening, and the brain is not actually growing to the size what it is expected to be. So most of the time, these children with retained or with retained primitive reflexes, they are very unpredictable. They are very emotionally unstable, and they are sometimes volatile in their temper, and they will be having poor sense of rhythm, or they, a lot of things are happening because there is no connect. The connect is not established if your reflexes are not integrated. Okay, so there is, how do I put it? Okay, so when we are talking about it, if you are not really looking at, if you are, most of the times probably your therapist might have been asking you, like, did your child walk early, or do you consider your child to be an early walker, or how many months your child actually crawled? So these are certain indicators if there is a delay in crawling, or there is a limited period of crawling, or if the child is an early walker, which means child might be still having an impact of this primitive reflexes at somewhere or the other uh, somewhere or the other in their line of functionality in their because they lose out, the logical rational thinking is lost, and they will not be able to have abstract thoughts or behaviors pertaining to it, and they lose something called as self control. So that's where actually a lot of things will go really bad in children if these things are not being taken care. So some of the issues what we usually look from a primitive reflex perspective, especially from the behavior side of it, they're always on fight or flight mode. They lack focus and attention. They're impulsive or they're aggressive, and their ability to uh, go for transitions, their ability to accept transitions, they will be having poor transitional skills, and lack of motivation is also not up to there. And they're most of the time they're disorganized and they're forgettable and they fidget a lot with things, and they're very close talkers. So these are certain things which you can observe from the behavioral perspective if retained reflexes are there. Why I'm telling all this is basically, if you really find any of these behaviors, don't always address it as a behavior. See whether there is any impact of this retained primitive reflexes on the child, thereby that kind of behavior is being shown, because as I mentioned, there is no connect, there is no integration which is happening within their brain. And from the motor perspective, what we usually see is their balance would be poor, their coordination would be poor, and their muscle tone, there would be a variation in the muscle tones, and they will be having poor posture as such. And most of the time, we find them having W sitting and toe walking, and their eye hand coordination is the bilateral eye hand coordination or hand to hand coordination is something which will be affected. And other side of the coin, academically, if you're really looking at it, they'll have poor handwriting skills. And when it comes to the emotional aspect or the emotional regulation of it, they will be going through a lot of mood swings, and their social skills are not as expected, and they will be having certain phobias or chronic fears, or they might be anxious, or they will be having these compulsions and rigid routines, and they will not be able to follow, or they will be having trouble following certain instructions. So apart from all this, they will be having a huge concern with separation anxiety. They will cling to one person, and it becomes very, very difficult. It becomes very, very difficult to separate, or their ability to perform in absence of that person uh, will automatically reduce. So those are certain impacts from the behavioral component of it, or from motor component of it, or from the emotional component of it. Just whatever I have told, if your child if the child has got more than two or three of what I have mentioned till now, that means there is a concern with their primitive reflexes. So just try to gauge it that way. The things would fall in line. Let's now. I'm going to make you go through certain videos, and then we'll discuss about each one of it. First, I think. Uh, I think internet is not supported. First witness, we have pushed from the tree, and the response is the child turns towards the side with a straw and opens their mouth. And if there is an abnormal response, and the abnormal response is lacking of mouth opening and moving away from the stimulus. So to integrate the routine reflex, we will give strokes with finger, and the stroke will be given like this. And also we can give with the brush. So to integrate, we use these exercises. Perfect. Now, that's how you ideally check for the rooting reflex. And the rooting reflex always, it helps infants or it helps a child to find the breast or the bottle by turning their head towards the stimulus. Like when you touch it, they turn towards that side and they open their mouth so that it facilitates them to latch onto the breast or latch onto the bottle for feeding. So that's the normal role what actually rooting reflex does in a kid. But the impact, if it is retained or impact of the retention of rooting reflex, it will directly lead to their inability to find and accept food, which means they might struggle to orient their mouth towards the food. And the second one which would get affected if rooting reflex is being retained is they will be having concerns with the feeding coordination, because a retained rooting reflex will cause difficulty with proper mouth positioning for feeding, which automatically will have impact on their sucklings, on their biting, or on their self-feeding from a spoon or a cup. So transition becomes very difficult for a child if a primitive reflex of rooting reflex is retained in them. And usually they tend to develop gagging or choking is also one of the thing, because they will not be able to adjust, they will not be able to adjust their head to head or mouth properly to accommodate different textured food. So different textured food or the volumes of food, which most of the time results in choking or gagging in these children. And usually if primitive rooting reflex is retained or not integrated, uh, they will not become independent in self-feeding. So that's about rooting reflex. So did you guys understand how to check the rooting reflex, or you want me to play the video again?
So please play once again.
Sure.
I'm going to demonstrate rooting reflex. First, I do the stimulus. For stimulus, we have to push forward the cheek, and the response is the child turn towards the side we have stroke and opens their mouth. And if there is an abnormal response, and the abnormal response is lacking of mouth opening and moving away from the stimulus. So to integrate the rooting reflex, we will give strokes with finger, and the stroke will be given like this. And also we can give with a brush. So to integrate, we use these exercises.
Is that good enough? Any questions on this for me?
So she's mentioning if the mouth is open, but if in the case like a child keeps the mouth open, then in that case, how we'll check?
Well, ideally, see, when you are stroking it here, the head the head will rotate towards that side, and you can see that mouth getting opened while turning the head.
Understand? Yeah.
Okay. So that's what a small baby does, right? When you take a baby to breastfeed the child, the minute something touches over around their lips, they immediately tend to turn that side and open the mouth, right? If you really look at an
Yes, sir.
infant going through this, yeah.
I'm going to demonstrate the sucking reflex. In the sucking reflex, the stimulus is touching the roof of the child, and the abnormal response is child is able to suck when the roof is touched, and the abnormal response is absent, or there is poor coordination and fatigue in the rhythm of the movement. To integrate the sucking reflex, we use 𝐲𝐵 and 𝐸 bite and release from the molars to the incisors. First, we put the 𝐸 over the molar, bite, 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 release, bite, 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 release. Next, coming towards the incisors, bite, 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 release. Be done on both the sides.
Well, this is how you test for suck and swallow reflex. Basically, suck, swallow, breathe. These three things go together, and sucking reflex is the one which would initiate that swallowing. It would initiate that breathe out pattern. So usually, this reflex usually enables the baby to suck, swallow, and breathe rhythmically, especially while feeding. And it is crucial because of the reason of this particular reflex, the act of feeding becomes safe, and it prevents child from aspirations. It will not allow the food or the liquid to enter their airways. So this reflex is the most important reflex, because it's not just associated with feeding. It is one of the component which will help a child to develop their language and to develop their communication skills too. And if this particular reflex is retained, as what Vijay has mentioned out there, there will be a difficulty in coordinated suck, swallow, and breathe out pattern. They will have lot of struggle, especially when it comes to transition between sucking, swallowing, and breathing, which automatically increases the risk of aspiration or choking. And apart from that, what usually, if this particular reflex is retained, what usually happens, other areas which gets affected are their weak or inefficient sucking would be there, and excessive gagging and choking, and they will develop something called as oromotor dysfunction in their inability to develop a coordinated movement, or it might lead to persistent oromotor difficulties during feeding as such, because they don't develop, if this reflex is retained, they don't develop the act of chewing and then swallowing. So if you really find a child not chewing the food, or not chewing the food in terms of their inability to uh, make these rotatory jaw movements to rotate the food and chew the food, but if the child is swallowing it directly, if whatever you keep on the tongue, they might just take it back, right? They might just push it into their pharynx. So if that is happening, the thing which you need to be looking at it is whether this particular reflex is still not yet integrated in them. Any questions for me on this? Okay.
Reflex, when startled, the child will extend their both the arms and legs and retract them back. So this is the normal response, and in case of abnormal response, there is excessive startle responses, disruption during mealtime, or there will be inability to stay calm during the feeding. So to integrate the reflex, we use rocking ball exercise. In that, we have to flex both the knees of the kid and both the arms, and then we have to flex the head, and we have to do the rocking with 20 counts.
Well, Moro's reflex, did you understand that, or you want me to replay the video again?
Reflex, when startled, the child will extend their both the arms and legs and retract them back. So this is the normal response, and in case of abnormal response, there is excessive startle responses, disruption during mealtime, or there will be inability to stay calm during the feeding. So to integrate the reflex, we use rocking ball exercise. In that, we have to flex both the knees of the kid and both the arms, and then we have to flex the head, and we have to do the rocking with 20 counts.
Perfect. So Morse reflex, as otherwise is also called as a startle reflex. So usually, if this is one of the major reflex, if it's not integrated, or if it is retained in a child after 6 or 7 months of their birth, it will create a lot of trouble in the feeding. One of the major reflex which will have an impact on feeding as such, because if it is not integrated, it will create something called as heightened sensory sensitivity in the child, which this heightened sensory sensitivity is not just for the sounds, but it could be touch, it could be for the textures of food, it could be for the smells, or it could be for the sounds. And this usually will have a very high impact on the child, especially during the meal times, because child may show signs of distress, refusal, or aversion to food as such, and they will be having overreactions to food textures and smells. They will have increased risk for refusal, for food refusal, especially because they become aversive to specific foods, or they completely refuse to eat altogether as an act itself, because the mealtime, the experience of the mealtime in itself will become so stressful for them, they may not be able to tolerate new or unfamiliar foods also. So this will cause, or this will take a child into the behaviors which I have spoken. They become more irritable, or they will be overreacting if there is a retained Morose reflex.
In the Palmar reflex, the stimulus is we have to put any object in the child's palm, and they'll try to grasp, and it is the normal response. And in case of abnormal response, there is difficulty in releasing the object and using the utensils independently. So to integrate the Palmar reflex, we will give strokes on the palm like this, or we can also write something.
So basically, Palmar grasp reflex, it's one of the major, again, one more major primitive reflex, because it helps in developing hand-eye coordination in child. Uh, Thereby, their ability to use both their arms for feeding would be more effective. So if the Palmar reflex is not integrated, if the Palmar reflex is still retained in a child, that will lead them to have difficulties in holding utensils, or impaired motor coordination would be a problem, and there will be a huge resistance to self-feeding itself. The reason behind that is because they still haven't developed the voluntary control over their hands. So you can really understand that they have not developed that voluntary control, but somebody is forcing them to eat, or somebody is asking them to hold a utensil with both the hands, and they still have not developed the dexterity skills to manipulate the objects or manipulate the food in front of them.
Tongue thrust reflex, we have to put the finger or foot in the front of the tongue, and here the child pushes the foot out of their mouth, and it is the normal response. In case of abnormal response, there is persistent tongue thrusting and difficulty in accepting the solids. To create the tongue thrust reflex, we ask the child to place the tongue to the tip of their mouth. So put the tongue here, and we have to count for 5 seconds. 1, 2, 3, 4, 5, and then relax, and then repeat. Stop.
Yeah, basically, if tongue thrust is being retained, or if a child is having tongue thrust, the classical way of looking at it is their inability to hold the food, or their ability to drink liquids or take solids with the tongue. There will be a lot of spillage around. You can see fluid coming out of the mouth. You can see uh, other way of putting it, apart from feeding, would be the clarity of speech would not be there. When they make certain sounds, the clarity would not be as much clear as what it needs to be. But from the feeding perspective, it would cause a lot of difficulty because it does not allow you to keep the food inside the mouth. So it keeps throwing it out. Okay.
The stimulus is whenever we flex the neck, the both the arms and legs should be flexed. And this is the normal response. And whenever we extend the head, both the arms and legs should be extended. So in case of abnormality, there is no response at all, and there is difficulty in body coordination. There is instability in feeding. Integrate the reflex. These are the specific exercises we recommend. One is cat stretch. This is the cat stretch. And crawling while holding some object under the chin.
Yeah. So when you talk about symmetrical, STNR is nothing but symmetrical tonic neck reflex. And this is one of the most important reflex, because STNR helps with the development of crawling by allowing for controlled movements of arms and legs. So it will have an impact on how the posture needs to be maintained while feeding. So usually, if this reflex is being retained in children, they will be having concerns with their postural control during meals, where they will have a difficulty holding their head and neck steady while eating, which is one of the major prerequisite, right? If your feeding has to be good, your posture needs to be aligned. Your posture needs to be upright for all the phases of feeding, right? So STNR helps you with this postural control, and it helps the child resolve the concerns pertaining to positioning while feeding. So if this is not there, this will lead to a heightened frustration in them, because they are not able to coordinate their body movements, and that would lead to resistance or refusal to eat.
In ADNR reflex, the stimulus is turning the head towards the side, and the side of the hand and leg is extended, and the other side is flexed. This is the normal response. And in case of abnormality, there is no response at all, and there is difficulty in using the hands or arms while feeding, and there is asymmetrical feeding posture due to abnormality. To integrate the reflex, the positionings are first is we have to lie in prone lying position with the hands towards the side. Exercise is the head is turned towards one side, and the side which the head is turned should be flexed. And position is the head will be towards opposite side, and the opposite hand and opposite leg will be flexed. So to integrate the reflex, these are the positionings you should follow.
Well, when it comes to 18R, the asymmetrical tonic neck reflex, that probably you would have understood by the way it is, right? The minute the child turns the neck to one side, automatically the arm is going into extension and this arm is coming into flexion. So, which means every time it does that, every time the head is turned, their body is automatically moving along with that. So, if this particular reflex normally helps child develop bilateral coordination and hand-to-mouth coordination, hand-to-mouth movement. So if this reflex is still retained, the classic way you can identify that is there will be impaired hand-eye coordination or hand-to-mouth. Taking the food from their plate to mouth would be very challenging for them. And this discomfort or lack, and it can create that lack of focus, especially during meal times, where we perceive most of the time that child is not cooperative or child is not paying attention. Actually it is because of this retained reflex. Every time he does that, he is losing that. Every time child turns the head, he is not able to establish a coordinated hand to mouth movements at all.
In the reflex, we should apply the pressure to both the palms and the child open their mouth and say, ah, this is the normal response. And in case of abnormality, there is lack of mouth opening and there is delay in initiation of feeding behaviors. So to integrate the reflex, the steps we will follow is massaging the palms or fingers with different textures. For example, with a cloth, brush, or any vibration tools. So here we have to rub the palms and the fingers with warm washcloth. And we can also integrate with finger painting or sensory bin activities, like using the rice, sand, or beans, or anything is fine.
I think this reflex was self-explanatory in itself.
The child is held horizontally and we have to support their trunk. So in case of normal response, the child head is held up and trunk is arched back. So in case of abnormality, there is no response at all and there is poor head control and weak back stability during the feed. To integrate this reflex, first important activity is the child is held in prone lying position. Both the hands and legs are lifted. And second activity is the same. The child will be in prone lying position, but here the foot are rested on the floor and only the hands are held up. So you can use activity like throwing and catching the ball in this position. Third important activity is lying prone on the therapy ball with the support.
So basically your Lando reflex helps to establish a very good head control and strengthened neck muscles, which are the most important things. Before we actually work on a child, we always tend to look whether the child is able to keep their neck and neck in a coordinated fashion, and do they have that strength to sustain it for longer duration of time. So if there is a retained Lando's reflex, that means there is the coordination between head and neck and the shoulder part is lost in these children. I guess we'll come back to other reflexes in the next session. So do I have any questions till now?
No, sir.
Okay, if you don't have any questions, probably in the next session, probably we'll be discussing the remaining part of the reflexes. I'll be still showing the videos, and again, I'm saying if parents really want to know how to look in for this feeding, please send an email to me. I'll send you the feeding evaluation sheet, which is self-explanatory in itself. Each statement is self-explanatory in itself. So you can fill it and send it back so that I can help you out in better understanding on how to go about the feeding challenges what you face with your child. Shravani ma'am, if you can just keep our email ID and the phone number, they can probably either send us WhatsApp or they can send an email to us.
Sure, sir. Sure. And once again,
Sir,
thank you for your.
I have one small
Hello.
question, sir.
Yes,
Maybe
sir.
for 1 minute. So, sir, like Athar, he's not eating like fruits and vegetable is very less. And one more issue I see, he never sit in one place and try to eat. Always try to lay down and eat. Are this has any impact?
Yes, sir. Hello?
Yeah, sir. Able to hear me?
Yes, yes. In others' case, when last time when you have come from Virginia, in others' case, there are a lot of primitive reflexes which are not yet integrated in him.
Okay,
So
okay,
we
okay,
need to be working on integrating those primitive reflexes.
okay, 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 sir.
Okay?
Okay, sir. Thank you.
Yeah.
If anybody have any other questions, or we'll close this webinar. All right. Dr. Sir, thank you so much for this insightful and engaging talk on primitive reflexes. Your expertise and clear explanations made the topic both accessible and fascinating. We truly appreciate the time and effort you put into sharing your knowledge with us. Thank you once again.
Okay, thank you, ma'am. Thank you, everyone, for joining us. Don't miss the series, because probably if you miss one topic in the series, maybe you may not be able to connect yourself for the remaining topics. So just try to find some time, because this is going to be every Saturday at the same time. And so try to utilize this time which has been given to identify for yourself the concerns, or when you go to work with the other therapists. This is to empower you with the knowledge of what you need to be knowing, and how you can help your child better. Okay, thank you so much, Shravani ma'am, for allowing me to take this. Thank you. Thank you, everyone.
Thank you, everybody.